Everybody right to go? Thanks for joining us for the daily update. First things first, there are 9,998 cumulative cases of coronavirus in the Victorian community, 723 new since we last updated you. Given the volume, I'm sure you'll understand that breakdowns in relation to those cases will be a feature of the Chief Health Officer media release that will come out later on today. There are 5,385 active cases, 4,516 in restricted areas, so Melbourne Metro and Mitchell Shire, and 255 in regional Victoria. And I'll come back to regional Victoria in just a moment. I'm saddened to have to report that the total number of people who have died because of this global pandemic in Victoria is now 105. That is 13 additional fatalities. To the extent possible, we'll provide you with any additional information, but what I can share with you now, 3 men and 3 women in their 70s, 3 men and 2 women in their 80s, and 2 men in their 90s. We send our condolences, our best wishes, our thoughts and prayers to those families. This will be incredibly challenging. The best at this stage, there's still some confirming work being done, but I think 10 of those 13 are connected to aged care, but we will confirm that later on in the day. In terms of tests, we have now conducted 1,574,626 tests, some 19,921 since we last updated you. Can I thank everybody who's presenting for a test? It's critically important. We're deeply grateful to you, and what that means is we can track the virus, we can put our best efforts to work to try and contain the spread beyond you and your close contacts. But of course, if you're not coming forward and getting tested, we simply don't have that knowledge. We don't have what is central to our most powerful intervention, and that's tracking and tracing all of those positive cases and those that they have come into close contact with. So again, thank you so much to everybody who is coming forward and getting a test. It's very, very important, and it's impressive to think that we have one of the highest testing rates anywhere in the world. More than 1 in 5 Victorians have been tested, and we will only continue that if people continue to come forward and get tested when they have even the mildest of symptoms. In terms of hospital, there are 312 Victorians in hospital. 34 of those are in intensive care. Aged care, there are a total of 913 active cases in aged care. And I now want to turn to one other update and then some announcements in relation to regional Victoria. Just in terms of aged care, as I did yesterday, I just want to try and give you some sense of those worst affected aged care settings and some of the interventions that have occurred there. St Basil's is being managed by the federal government, and there's still significant work that needs to be done there and is being done. Kirkbrae, Eastern Health are now managing that facility, and that is, I'm told, that is stable. Outlook Gardens, Monash Health are running that facility now, and that is stable. Epping Gardens, Austin Health are running that facility now, and it too, it is a very challenging environment. There were 2 residents that were transferred. They were emergency transfers to Royal Melbourne Hospital last night. They, I think, have been or are in the process of being transferred to St Vincent's Private. I don't have any further transfer numbers for you or any other narrative on any of those 4 sites, other than to say it's a big team. It's an impressive team in terms of their commitment and their absolute resolve to get in and get the job done. And to all of those nurses and others who are doing that important work, I thank you deeply. It's very challenging, very, very confronting often, and they're doing an amazing job. To all of our partners in that effort, we're equally grateful. There's no lines here. We're all on the same team, and we're all working hard to get this job done. But it is very, very challenging work. To family members, to residents, please know and understand we are, in a joint sense, doing everything we possibly can to provide the care and support that you or a loved one needs. That is not an easy task, but the effort is absolutely enormous, and I'm very grateful to all of those involved. If there's any further updates we can provide you, whether that be later in the day or indeed at tomorrow's briefing, then of course we will do that. Now, I just wanted to update you on ADF door knocking as well. Yesterday there were 30 teams out door knocking positive cases. My latest report is that they have, in cumulative terms, they have door knocked 798 properties. There were 269 that were visited yesterday. Now, I don't want this to be seen as criticism or blame, but I'm obliged to point out that there were a number of people who were not home. They will be referred to Victoria Police. There were also a number of other people who, when there was a discussion, the person that the ADF and the Health Department as a joint team were looking for, the person who has a confirmed diagnosis having coronavirus, they've got a positive test, they weren't home, but a family member was, and the family member helpfully pointed out that that person, a positive coronavirus case, was in fact at work. Beyond that, there was some instances where people were not perhaps clear on what they needed to do. The important thing is that they got that information because they were door knocked. And on the other end of the spectrum, and I'll come back to work in a moment, on the other end of the spectrum there were a number of people who needed scripts filled, a number of people who were running very low on some of the basic household items, everything from some groceries, toilet paper, things of that nature. Because of that visit, we've been able to source all of those things for those people. So as I said yesterday, this is not just about compliance, it's also about us visiting and saying, what can we do for you? What do you need? And I think that's a really important point. None of us should miss that point. That doesn't mean, though, that you are allowed to be out of your home or at work or at the shops if you are positive. If you're a positive case, then you need to be at home and you need to be isolating. And that is a very important message. To have found even one person who had disregarded their diagnosis and instead had decided to go to work is very disappointing. On the broader issue, these numbers today are a reflection of increased cases in aged care. That's one element if you were to break it down. And if there's further analysis and subsets we can put in to the Chief Health Officer release later in the day, we will. But leaving the types of workplaces to one side, because it's not an opportunity, or it shouldn't be read to be an aged care debate. That's not our concern. The key point here is that too many people are still going to work when they have symptoms. Too many people are going to work, even some, when they have a positive test result. That's a small number, though. I think a bigger number are people that are between having the test taken and getting the results. They are still presenting to work. And for so long as that continues, then we will continue to see numbers go up. The only way that numbers will come down and do so steadily is if people, when they are unwell, even very mildly unwell, go and get tested quickly, and then isolate until they get their test result, and then of course based on that result do as they're asked to do from that point onwards. To put it another way, we will not get businesses reopened and we will not see many businesses survive, which is what I want to achieve here. It's what we all want to achieve here, for so long as people continue to go to work when they are unwell. It's not in your interests, it's not in the interests of public health and safety and saving lives, and it's also not in the interests of the workplace where you work, because ultimately, if there is a positive case in that workplace, then that workplace will have to close down. There will be an enormous amount of work, thousands of emails and phone calls and text message and hundreds of hours of work, contact tracing each and every one of the people who work there, and of course deep cleaning and very significant expenses that will have to be incurred by that workforce, by that workplace I should say, by that business. So again, it is incredibly important that each of us in our different roles try to get the message out to as many people as possible, regardless of your industry, your postcode, your background, and even your employment circumstances, because there are payments available, the $300 payment while you wait for your test result and a $1,500 payment if you are positive and you're in insecure work and you simply don't have sick leave to fall back on. The key point here is we've all got to get the message out. If you've got symptoms, the only thing you can do is get tested. You just can't go to work, because all you'll be doing is spreading the virus. I know there will be a small number of people, or let's not even try and work out how big it is. There may be a group of people, in fact we know there is a group of people, who, unbeknownst to them, they may have symptoms so mild as to not notice. They may have no symptoms at all. The challenge here and the wicked nature of this virus is that you can be at your most infectious during that time. They're not the people that we're appealing to, because they are completely unaware of the fact they have symptoms. The appeal, the request, the urging is to those who have a scratchy throat, headache, fever, runny nose, all of those well understood coronavirus symptoms. You may not have coronavirus, but you can't take the risk. You've got to stay at home. Only thing to do is to get tested, and you've got to isolate and not go to work while you wait for those test results. Now, I just wanted to go to some announcements now in relation to regional Victoria. The active cases, the split that I spoke about before, 4,516 in Metro Melbourne and Mitchell Shire, and around 255 in regional Victoria. 159 of those active cases, 159 of those 255 active cases, are from 6 local government areas that surround the Geelong corridor. That is why I'm announcing from 11:59 p.m. tonight, so essentially from midnight tonight, in the local government areas of Greater Geelong, Surf Coast, Moorabool, Golden Plains, Colac Otway and the borough of Queenscliff, people will no longer be able to have visitors to their home. There is currently a limit that is now going to 0 from midnight tonight. So you cannot visit friends, they cannot visit you. Hospitality venues will remain open, and I just want to, I know that may seem counterintuitive, I mean, many things in this virus are, but some of the transmission is household to household. The larger part of it is, of course, in workplaces, but some of the transmission is in households. And that makes sense when you think about it. People are not necessarily keeping their distance in their family home. It's a natural thing. You let your guard down. Hugs and kisses and handshakes, not necessarily adhering to the protocols that are a feature of hospitality, cafes, restaurants, pubs being open. They are supervised environments. They are regulated environments. There are time limits, for instance. They're in a very different set of circumstances. I know that it may seem, as I said, counterintuitive that you can go to the pub but you can't go to your mate's place, but ultimately that's where the data drives that decision. The data drives that decision. That's where the transmission is. It's not in cafes and restaurants, but it is in small numbers in people's homes, one family to another, a group of visitors either getting it from a family that have got it and may not know, or vice versa. So from midnight tonight, 11:59 p.m. tonight, there can be no visitors to your home if you're in any of those local government areas that I have listed. I'll come back to some broader commentary about regional Victoria, but the second announcement that I want to make is that from 11:59 p.m. on Sunday night, so midnight Sunday night, every single person in regional Victoria, when out of their home, will need to wear a mask or a face covering. In other words, the rules that currently apply and have been so well taken up by, and I'm very proud to think that people across Melbourne and Mitchell Shire have stepped up and are wearing masks. It's very hard to find anybody as you move around the community that isn't wearing a mask, and I'm deeply grateful to each of them for doing that. It's inconvenient, it's challenging, but it's essentially stage 4 for Melbourne, and it's something we can do in regional Victoria without causing significant economic cost, but getting a really significant public health benefit. So that is from midnight Sunday. Everyone in regional Victoria, and therefore everyone across the whole state, will have to wear a mask, and I stress, or a face covering whenever they're out of their home. The usual exemptions that are now pretty well understood in terms of Metropolitan Melbourne and Mitchell Shire, strenuous exercise, some of the things that the Chief Health Officer has spoken to, they will apply in regional Victoria as well. But I don't think this is the biggest leap, because I think that, again, this is a point of pride. Many people in regional Victoria, where they have that sense that they can't distance, can't maintain that 1.5 metres, are already wearing masks. That's certainly the case in a number of very big regional cities. So that is an appropriate next step. Both these decisions are on the advice of the Chief Health Officer, and I just want to explain where that advice comes from. We have low numbers in regional Victoria, and we want to jealously guard that. We want to keep those numbers low. These are preventative steps. They're an abundance of caution approach, if you like. It will be inconvenient for some, but at the end of the day, keeping those numbers very low is about protecting public health, protecting vulnerable people, protecting every family, but also protecting the economic benefits that also come from having regional Victorian case numbers very low, a number of settings open in regional Victoria that are not open in Metropolitan Melbourne or Mitchell Shire. In very basic terms, we need to jealously guard those low numbers, and these steps, no visitors to your home in that particular corridor, and masks whenever you're out of your home, face coverings whenever you're out of your home, across the board in regional Victoria, are two high impact, low cost measures when it comes to jobs and livelihoods, but they will have a significant impact in keeping those numbers low and not having a situation where the very much better circumstances in regional Victoria are no longer the case. We want to keep those numbers very low. That is the logic behind this. That is the advice, and that is the announcements that we have made today. There are many other matters I could take you through, but on business support, I know Lundy had asked me yesterday. I've asked for a full report on that, and I'll most likely be able to give that to you tomorrow. And I know there was significant interest in those payments, the $300 payments to those who are waiting for a test result and are in insecure work. I can confirm that there's more than 1,000 of those payments have been made, but with your indulgence, I'll leave a fuller report on that until tomorrow as well. I was loath to pull people away from processing payments in order to provide me with a very detailed breakdown, but that'll happen overnight when people can't be telephoned, and hopefully I'll be able to give you some further information about that tomorrow. Essentially, you can't go to work if you're sick. You've got to get tested, and then you've got to stay at home until your results come through. Thank you to everyone who is following the rules. Thank you to everyone who is stepping up and doing quite amazing work, particularly in aged care settings, where there are some very confronting and challenging issues that have to be dealt with there. But I'm confident that those staff, regardless of the uniform they wear, regardless of who signs their paycheck, they're all working really hard in order to provide the best care and support possible. These rule changes are necessary to safeguard the unique status that regional Victoria enjoys, to jealously guard those low numbers and to keep them low. That is very important, and I apologise for any inconvenience that those arrangements may cause, but that's nothing compared to a situation where numbers become out of control and become much higher in regional Victoria. These are small things but powerful things to do to keep those numbers low. I'm happy to take any questions you have.
Is there any more detail on why such a big jump that's twice the previous 2 days? Is it just the aged care and the workplaces that target testing?
I'm loath to go into too much detail because I frankly don't want it to be read as a criticism of any one sector. So the point that I make is that there are a number of positive cases in aged care, and therefore they are being reflected in these numbers. That's one point. The other issue around targeted testing, where there's been significant outbreaks, the more outbreaks you have, the more testing you do, and you will find cases. That number is not there. There's not 700 plus community transmission cases. The community transmission number will be but a fraction of that. And if we can provide you with some further details and further interpretation of trends in that community transmission number. So those cases where we just don't know how they got it, that's not an outbreak at a meatworks. That's not an outbreak in a person's home. That is cases where they are a complete mystery to us, despite all the best efforts of those who've tested positive, their family members, the public health team and others. That's not the 700 plus number. That's a much smaller number. If we can get you some further analysis, further interpretation, and therefore some further insights into modelling, both look back, so what's happened over the last couple of weeks and what the modelling says for the next couple of weeks, we'll be more than happy to do that. That probably is not best done through the release. I think that might be a feature of tomorrow or one of our briefings over the course of the weekend.
How should people respond to the number then? 'Cause I think a lot of people hear that.
Yeah, of course.
They're very scared.
Oh, there'd be significant concern across the community, and I'm obviously concerned to see these numbers increase. It is not unexpected in some ways when you have got so many cases in private sector aged care, when you've got so many cases connected to big outbreaks in specific workplaces. It's not unexpected that once you test those people for a reason, you want to find the virus, you want to find the number of people who've got it, and then you take appropriate steps with each of them. That'll drive these numbers up. The community transmission, the kind of mystery cases, that's still too high, but it's certainly not at 700. It'll be a very small number in that scheme of things. I can understand people are concerned. We are all concerned as well, and that's why the central point, the most important point, you cannot go to work if you are sick. You simply can't. All you will be doing is spreading the virus and putting people at risk. And it's not a matter of judgment, it's not a matter of criticism. We've dealt with what I think is a really significant part of the driver for this, and that's the notion of I don't have sick pay. If I don't work the shift, I don't get paid. How do I pay my bills? How do I feed my kids? I'm not criticising people for it's the wrong choice to make, but I understand it. I understand why people would make that judgment. The most important thing is that hopefully from the report I just gave you, there's more than 1,000 families who have not had to make that choice because they've come forward, they've got their payment. If they haven't got the money in their account, they've certainly been told it's coming, so like a payday. That is a really important step. If you're positive as well and you don't have sick leave to fall back on, there is the $1,500 payment also. Ralph, I understand people are concerned, and we're all concerned when we see numbers going up rather than coming down, but at the same time, we know what's driving at least a very large part and a controllable part of this, something we can actually influence, and that is patterns of behaviour and people continuing to go to work with symptoms. It's not a matter of judgment, it's just what the data's telling us. And we've all got to play our part in getting those messages out. I went through a list of different companies and other peaks who are working with us, but the message is very clear to every single employer as well. You've got to step up as well, just as we are, to make sure that nobody in your workplace is presenting with symptoms, and that if they've had a test and they turn up for work, no, they cannot be there. Now, it's not a matter of hard and fast. The employer would not always know those things, but to the extent they can lift and do more, just as everybody else is, then that'd be something that we'd be very, very grateful for.
Just an update on the ref number, is there one? Have you got any updates?
It's still hovering around 1 or just above. The problem you get into is when you have so many cases, even a ref at 1, so the number of people that each positive case infects, that will continue to see your numbers within a band, relatively stable, but not coming down. The key point here is until we can get only every second or every third person infecting someone else, we won't see these numbers come down. That's my last advice, is that's relatively stable, but still far too high for us to see these numbers fall.
I mean, that 159
Yes.
is that associated with that high?
Yeah, so it is that grade. The Greater Geelong's a bit confusing because that's the name of the council, but it is Geelong Plus. So it's those 6 local government areas that I spoke about. The vast majority of those are workplace outbreaks. So the COLAC number is into that, but we have seen, it's a smaller number, but it's a worry, and that's why we've made these difficult but I think necessary decisions today. We have seen a number of cases where families are giving it to each other, visitors in your home. again, I've tried to be as clear and as frank as I can be, but I will repeat this again. I will put in place the restrictions that are targeted to dealing with the problem. We're not going to just, so that there's a sense in the community that we're doing things, going to do things that are disconnected from where the problem is. That doesn't make any sense. That just costs jobs and I think adds to the sense of frustration and fatigue that everybody is feeling. If this was not in people's homes, if we didn't have that sort of transmission and those mystery cases as well, then we wouldn't have to make these choices. We could be solely focused on large workplaces, at high risk workplaces. But when the advice comes in and says there is community transmission down in that corridor, there are household chains of transmission as well, then that's exactly the right, this is exactly the right step to take. And again, I go back to that counterintuitive point, the pub and your mate's place. When you think about it, and this is exactly what the public health team have done, thought deeply and looked at the data in really fine detail. They are controlled environments. Having friends over to your house is not a controlled environment, and we do. It's not a criticism. It's just one of those facts of life. I think people let their guard down a bit, and then we finish up with people infecting others.
Why not send a message to just stay at home and not close the pubs in those areas for 3 or 4 weeks? Just send that message that you need to stay.
Well, I think sending messages and taking decisive steps are not always the same thing. So if the data said to me, and again, I'm not criticising the question, it's a perfectly fair question, but if the data said that this was being transmitted in cafes, restaurants, pubs, then we would shut them. Don't be in any doubt about that. But that's not the position that the Chief Health Officer's detailed analysis and the Public Health Team's detailed analysis of these numbers, that's not what the data tells us. I can't rule that out in the future. I don't want to get to that. But let's not have a debate about what next steps well down the track or perhaps never might have to be. Let's just simply, all of us, I'm sure, we can agree, numbers are low in regional Victoria and we want to keep them low in regional Victoria.
These communities, though, including local mayors, for a week now have been asking for further restrictions in their areas. And you're saying it's based on data, but that's obviously there's a lag between. So why is this decision coming now and not even a couple of days ago when you could have done it and stopped the spread even quicker?
No, I don't think that's the case at all. I think that you need to analyse the data and you need to follow the advice. And the advice has been confirmed and that's the steps that we're taking.
And so consultation with local community members, including mayors that are on the ground, isn't really of a concern to you?
I didn't say that. I've never said that. I don't know where you would get that conclusion from. That's not the position at all.
Choices based on
Sorry?
data, not based on what people are saying on the ground. And it's clearly been shown that your contact tracing teams are at least 5 days apart in some areas. So how
I don't think.
the data is actually telling you the adequate information?
Well, again, that's not the issue that I think I've gone to. I've gone to the very clear story that the data tells us. I don't accept the commentary on contact tracing that you've necessarily made. We work with local communities, we work with stakeholders, we work with everybody who is impacted by this. This is the public health advice, and that's exactly the basis on which we act. These are preventative steps. In terms of spread, what you're putting to me is that there have been more people become infected because this wasn't done a week or 2 weeks ago. I don't accept that at all. There's an outbreak at a very big employer in that local community. I think that's the community that you're referring to. There are a very small number of additional infections that are all linked back to that workplace outbreak, and to have applied these restrictions a day ago, a week ago, a month ago, the notion that that would have delivered a vastly different outcome, that's not the public health advice. In fact, the public health advice is very different to that. Again, people can have their own opinions on this, that's absolutely fine, but the key point here is the advice to me is to take these steps. That's why we're taking them. If that advice were to change and there were further steps to take, then we take them too. Sorry.
Sorry, your message for days now, once a week has been, if you're sick, stay home. If
Yes.
you're waiting for a test result, stay home.
Yep.
And yet you're saying today that people are still not getting that message.
That is correct. It's not.
So
Yeah.
then what's your level of frustration and despair
Oh.
now that people are still not getting that?
Oh, this is not about how frustrated I feel or how tired I might, but that isn't the issue. the issue here is it's not just me standing at this podium every day. Every platform, every channel, every mechanism that we can use to get that message out, we are doing that, and we will continue to do that, and we'll again be very grateful to you if you can assist us in that work. I'm very grateful. On the issue, though, what I would just say, it is not the outcome we want, that people are continuing to go to work, but the fact that more than 1,000 people have got that payment or have been told they're getting it and it'll be processed soon. That is 1,000 people who might otherwise, because of economic hardship and because of insecure work and no sick leave to fall back on, they may have been at work. So that's a positive story. But even with that, it remains the case that too many people are still going to work when they've got symptoms. We're not judging them, we're just asking them, there is support for you. Please don't go to work if you've got symptoms. That is our request of you. I can't be any clearer. If that continues, then these numbers will continue to go up.
But do you worry that people are no longer, there's definitely a difference between last lockdown and this lockdown, there's more people out and about on the road, more shops are open, and you worry that people are just living COVID life?
Well, ultimately, every Victorian, I think deep down, knows and appreciates that unless everyone plays their part, this lockdown will not end anytime soon. If we were to reopen across metropolitan Melbourne and Mitchell Shire today, then it won't be 700 cases a day. You can add a zero to that, and our hospitals will be overrun, and we will be conducting more funerals than, yeah, that's just not, that people know. I think deep down, I think people know that. And some, again, let's not detract from all those, the vast majority who are doing the right thing, but there are still some people who, for whatever reason, whether it be frustration, fatigue, whether it be some of those economic hardship issues, they're making the wrong choice. I just ask them, we're not looking to judge you on what you have done, we're looking to influence what you do today, tomorrow, and for the rest of this. Do not go to work if you have symptoms. Get tested if you have symptoms. Don't go to the shops. Don't be going out while you wait for your result. That's a really important message. And it's not every case, but it is a very significant driver.
Given the number of cases.
Yes, the same penalties will apply. And when we say, and it is mask and face covering, so I'd be indebted if we can get that message out as well. Any protection is better than none, but I'm confident for two reasons, that there won't need to be very many fines issued at all. I think people in regional Victoria will embrace this just as people in Melbourne and Mitchell Shire have. So that's the first point. And the second point is, of course, we're already seeing in a number of regional communities where people are wearing masks, and we're very grateful to them. So it's not such a massive step, but it does give you a really significant public health benefit. The costs are quite low. The impact really, when you think about it, is quite low. But the public health dividend, the virus spread dividend, is very, very high.
Given today's numbers, is there any,
Look, just Lundy and then Bridget.
given today's numbers, is there any chance that state-free restrictions will end on August 19 as initially planned?
Well, the timing for restrictions will be based on data. These numbers are far too high. If it were next Sunday, this Sunday, for instance, that we were due to open up again, then the answer would be no. But Lundy, just as I think yesterday, and I hope to be proven wrong in this at some point, but yesterday I think I was asked, is this a turning point? And I said, one day's data is not a trend, and that's been borne out today. So I can't tell you where we're going to be in another three weeks. What I can say, though, is that if people continue to go to work when they've got symptoms, or go to work between getting their test and getting their test result, or when they're door knocked by ADF and public health authorised officers and they've got the virus and they're not at home because they're at work, that's just going to see these numbers continue to grow, and restrictions will have to stay on.
Given what you said about wanting to see 3 cycles, though, technically halfway through the second one at this stage, you'd be getting into bed, so surely that would indicate that we can't reopen all.
Well, what I'm saying to you is we'll make announcements at the appropriate time when we've got as much data as we possibly can. I'm not trying to avoid the question. I don't have announcements today about what's going to be happening in 3 weeks, and I think when people think about that, even for a short time, they can, I think, appreciate that these are rapidly changing. We've got a whole range. We've got aged care, big challenge in aged care at the moment. We still have people going to work when they're sick. We have workplace outbreaks. As soon as we can be absolutely clear about what the next period looks like, we will be, but today's not the day for that.
How will face coverings work in the regional areas if you go to a restaurant or a gym? Do you take them feet?
The way it works is there's some models from overseas that we're going to essentially copy. So in Oregon and in some other places, if you're seated, you don't need to have the mask on. So when you're eating and drinking. But if you're not seated, you need to have the mask on. Now, I know that's going to be hospitality looking a bit different than it's ever looked. Staying open that's not where we're seeing these cases. That's not where the public health problem is. I think people will adapt to that, and that's worked in other parts of the world, and we're confident it can work here also. Yes. No, I think what I've said, so there's absolute clarity, I don't have a categorisation for St Basil's, but I know that people are in there. That's principally being managed by the federal government, and it may well be stable. I don't have a report on that right now. Kirkbrae, Eastern Health are in there, and that I'm told is stable. Outlook Gardens, out not far in my local community, that's being looked after by Monash Health, and I think Mulgrave Private Hospital. I'm very grateful to all of our private partners right throughout this. That is also described as stable. I don't have a descriptor for exactly where Epping Gardens is up to, but I do know Austin Health are in there and are managing it. This is a very, very challenging environment. I don't think there's much gain by me running a commentary on what may or may not have happened last night between management and health. That's not really the issue here. The key issue here is everyone's got to get on and get the job done, and that's what Austin Health staff are doing. And it's the residents that matter. It's absolutely the residents and only the residents that matter, and by extension their family.
Victorian, we may say that Victoria's public health is the worst resource in the country per capita. Why was the public health team allowed to fly for 18 months despite them raising concerns about it?
Well, I wouldn't accept that it's not appropriately resourced. This is a 1 in 100 year event. I think we're up to about $2 billion in additional funding, and I would see the health system in a much broader context. And I'd say to you that there's a reason why Eastern Health can take over Kirkbrae, why Monash Health can take over Outlook Gardens, why Austin Health can take over Epping Gardens, and that's because across the health system we've got more resources, not just as a result of the pandemic, but year on year, more resources and a record of investment. So I wouldn't accept those conclusions. I wouldn't accept that commentary. This is a 1 in 100 year event, and that team is bigger than it has ever been. But I'll boldly predict for you that when this is over, it won't be as big a team as it is now. And we will not be spending $2 billion on matters of public health, because if you were to do that, then, well, I don't know, wouldn't be much surgery going on, wouldn't be many ambulances turning up on time. Like this is a 1 in 100 year event, and therefore it is completely well.
About the baseline that your public health specialists, we had far fewer per capita than other states when this started.
Well, but Raf, they have scaled up. They've scaled up significantly, and that's why there are the last count. There's more than 2,000 people in there doing this work, and we're grateful to other states who, much like every summer, when you've got a challenge, it's a shared challenge, and there are people that are providing support and assistance from other state capitals, just as we would if the circumstances were different.
Using that bushfire analogy, we've always got people ready for bushfires. Why didn't we have more people ready in Victoria compared to other states?
I don't think you could ever have 2,000 people ready, and that's what we need. And in fact, we've got more than that. It's many more than that, really.
25 in Victoria compared to 66.
Well, people can make their own judgments, but the notion that our public health professionals are not very well equipped, well supported, and highly skilled, I think is simply wrong.
There's... You had 50 before
I don't accept that logic at all. If 50 people a year ago was the difference, well, that'd be a wonderful position to be in. I just don't accept that logic.
You're saying that it's well resourced, though, Premier, but the department itself was raising concerns with the government that didn't have enough resourcing. How can it be that the government ignored it?
Well, there are always bids for additional resources. There's not a person in the health system that doesn't bid for more money every single year. That's just a feature of these things. I'm being very frank with you. That's just the way it is. But ultimately, you've got to make decisions, and you could make all your decisions based on a potential 1 in 100 year event. I then think I'd be standing at a podium like this, and people would have some very firm views about all the other things in health that weren't happening because we had decided to take out an incredibly expensive insurance policy against not that it even would be, that's the other point. When you get one of these events, then you have to surge, you have to scale up. And there is no, but hang on, there is no, I'll come to that, Ralph, I'll come to that. There is no public health team in the country that is as big today as it was before this pandemic. They've all grown. They've all had to grow by enormous factors, just as ours has, and just as it may well need to continue to do.
Of that 2,000, sorry, of the 2,000 people in that contact tracing team, how many are actual contact tracing experts and how many support people that have been brought in and don't have expertise in the area?
I think, well, no, I wouldn't say any of them don't have expertise. I think they're all very well experts at the moment. They've become experts. But you'd never have 2,000 experts sitting around waiting for a global pandemic to come. You've got to skill up, you've got to surge, and that's exactly what's happened here. And indeed, that's what's happened in other states as well. There are many more people working in every state, certainly at the comparative, at their peak, when things were really challenging, more people working in every state capital and in every part of the country than there was before this pandemic. That's just the nature of these things. You have to scale up to make sure that you've got the people you need. In terms of infectious diseases physicians, public health physicians, there are always limits on how many people have got a lifetime's worth of skill. They are there, and others have been brought in. And for instance, I suppose the point I'd make to you, the fact that we've got more than 100 ambulance paramedics who have no responsibility in relation to public health doing contact tracing work, that just shows you can only do that when you've got a well-resourced health system and you've got people who can move in and out of given challenges. So it's always about best skills being put to the best use.
Last week you said that we had 2,000, or we wanted to get 2,100 contact tracers, and you said right after that we will need more in the coming weeks.
Correct.
So do you have a plan to upscale the contact tracing team, and given the 700 cases,
Yep.
do you think that we are actually capable of adequately contact tracing?
It's a massive challenge. There's no dispute between you and I or anyone else on that front. It's a very, very significant challenge. We've hit the 2,100. I can come back to you with some further details because it does change day to day. I've always been clear, if more needs to be done, then it will be. If there's more recruitment, if there's more people that need to come in, then of course we will do that. But when you've got this many positive cases, it is a significant challenge.
We're also now exporting it to Queensland, regardless of whether that new contact was. Will we now accept help from Queensland, from New South Wales and other jurisdictions if they're willing to give it in terms of contact tracing?
Well, Alex, I don't necessarily think that that's the best way to term the conduct of two people. But that's not, but that,
Will we accept help from
well, I was getting to that second part of your question. We already have been accepting support from public health teams across the country. I think I've made that point a number of times, and we're grateful, very grateful, that calls are being made, interviews are being conducted, work's being done. That was paused, particularly out of New South Wales, for a short period when they had the Crossroads Hotel issue and had to go and trace a large number of people. I'm sure that we might still not necessarily be up to the total amount of support that we had from New South Wales, but we're still getting significant support from them. I was on the phone last weekend, Alex, to Premier McGowan. We've got people providing us with support from as far away as Perth. So that's been a feature of this second wave, and it won't change, and I'm deeply grateful for the support that's being provided.
When are we going to increase the 2,100 that you have planned for that or not?
Oh, there's plans respond to each and every challenge we face. I think the point I was making was not so much giving you a definitive date on when we would step up. I think I was trying to provide some reassurance that, and indeed my view, that team, I couldn't rule out that it would get bigger, and in fact I think it's fair to predict that it will. And there's lots of contingency planning going in, both, and this is a really important point too, it's not just to grow the team, but it's also managing fatigue and managing some of those challenges, and I think Brett spoke to that the other day.
What legal protections do people have if they disclose self-inflammatory information for the purpose of contact tracing?
I'm not a lawyer and I wouldn't offer a legal opinion, but if you, in speaking to people, you know, what we want is accurate information, and I don't think anybody has been fined by virtue of disclosing matters during that long form interview. That's not the issue. The real issue here is provide the information so that you get a text message telling you you're going to get a call, take the call, provide the interviewer with accurate answers. There's no sense of anybody being punished because of that, and I certainly haven't been briefed on anyone in the example that you cite. I haven't heard any. I've got no advice that that's happened. We're much more interested. The most valuable commodity, and it's worth much more than $1,652, is who you've been with and for how long and in what circumstances. That's what we're after. That's the real treasure when it comes to that hour, what can be an interview for an hour. I should just also acknowledge, not only in thanking the ADF, but just so everyone doesn't miss this point as well, I'm not sure whether I mentioned it, we are now moving to, I can't be absolutely certain that we're there just now, but we will be very soon. Those teams of ADF will be visiting every single positive case. So ADF and a health department official go and visit and door knock every single person that has tested positive. That won't be, out of today's numbers, that won't be 700 homes, because there'll be some multiples, families, but there'll certainly be today, there'll be many, many hundreds of door knocks that are done as a result. So that's, again, not just for compliance, as important as that is, but it's also just to say, what can we do for you? What do you need? And are you completely clear on everything that you have to do over the next 14 days?
Have you considered making, beefing up punishments for those people who go and door knock, who know they're positive, and they can live with it?
Well, there are a number of tools available to us. I think there's a well-publicised case of a person who thought they'd put themselves on social media and brag about having gone through a police checkpoint. They've now, no, I'm coming to your point. They've now been found. I don't believe they received an on-the-spot fine. That's the low-level fine. I think they'll be charged on summons, and that'll be a matter for others. I don't determine those matters, but there's the on-the-spot 1652, and then if we go through a court process, it's much closer to 10,000. So there's pretty significant penalties.
Is there any testing going on in terms of blood testing to find out if there's more out there in terms of overseas being tested to see if people get antibodies in their blood?
Right. Yeah, no, I've read some reports of that. I would probably get the public health team to come back and provide you with that pretty clearly medical advice. Yeah.
Just on the assistance that's being provided by the centre, we have the OSMAC team providing it.
Correct.
I don't know whether you can give us any update as to where those
I can't. I'm afraid I can't now, but if we can come back to you and give you a sense of where they're working and what they're doing, again, we're very grateful to them for the assistance that they're going to provide, not just to us, but in many respects, very, very, very direct assistance to private aged care providers and their residents, and that's a very good thing, and we're very pleased to have some stability in those settings that were the most volatile. That's a product of a lot of people working very hard, and the team, further to Alex's point, I think it's not just in contact tracing, it's in direct response, it's in public health, it's in yeah, sorry. Yes. No, that's not the health advice at the moment. Again, things can change, but that's not the health advice. Mask wearing down there, as well as no longer, and indeed right across regional Victoria, in fact, as well as not having visitors in your home, is deemed to be, that's where the problem is, and that's where this action will have its most powerful impact. You want to go to Jenny now? Sure. Jenny's keen to get a go here. She wants...
Sorry, but just on schools, it
Sure.
would seem very unrealistic to expect that we would depart from home learning for schools to get term 3, that there's any chance of children going back into the classroom.
I think that, yeah, sure. Again, a bit like Lundy's question before, trying to forecast where we're going to be in another 3 weeks' time, 3.5 weeks' time is incredibly difficult, and it isn't really worth much. What I would say, though, the notion of having 700,000 kids plus carers, parents, moving around the community, going to and from school, doing pickups and drop-offs, I think that is not in any way compatible with these numbers coming down and keeping them down. So there's no change, and I think a change in the future is most unlikely. But we'll give parents as much notice as we can. We'll give school communities as much notice as we can. And while we're on the topic, if I can just again send my thanks, my gratitude to teachers and staff, to principals, and indeed to parents who've got kids at home. It isn't easy, but I think people, when they think about it, it's pretty obvious. If we had the best part of 1 million people wandering around the state every morning, every afternoon, and everything in between, then that's going to mean that we just spread this virus more. Now, Jenny wants to answer a question. She doesn't know what the question is, but she's very keen to answer it.
Given the number of aged care cases, do you anticipate needing to move any more people into hospitals? If so, how many? And are there any patients being treated yet in the residential care?
Okay, thank you. Firstly, can I say that today's number is incredibly disappointing, and if all of us as Victorians work together and follow the rules and stay home and wear a mask when leaving our home, we can bring this number down. In terms of aged care, I just want to express my gratitude to all of our health services who have stepped in and have provided support to those private sector nursing homes at this very challenging time. We have already transferred, I think the number was more than 200 residents to hospitals right across Melbourne, and they are both public and private hospitals. And I also want to thank our private hospital providers for assisting us with this massive task. And can I take this opportunity as well to acknowledge the Herculean efforts of paramedics, both Ambulance Victoria paramedics as well as non-emergency patient transport staff, who have been engaging in this massive job of transporting residents to those hospitals right across Melbourne. Look, this situation is one that we are monitoring on a daily basis. If there is a need for residents to be transferred to hospital because they need that clinical care, or if there are operators who are struggling to manage residents in a safe environment, then we will not hesitate to ensure that those residents get moved to a hospital environment. So it may well be the case that there will be more transfers that will occur in coming days, but there have been massive efforts just in the last 2 days to transfer significant numbers of aged care residents to hospitals across Victoria. In terms of the old Peter Mac, I'll come back to you with an answer on that if I can, Lundy. But we won't hesitate to utilise all the capacity that we have. Of course, it does depend on the particular needs of particular hospitals. That particular facility now is attached to St Vincent Hospital, who's doing a wonderful job in supporting the community. And if they need to be moving patients around to facilitate more patients needing to utilise their hospital, then of course they will utilise that additional capacity. We have lots of capacity in our hospitals now. We've created additional capacity, freed up healthcare workers by taking some very, very difficult decisions to pause elective surgery in recent days. And, we are well equipped and well resourced to respond to the current circumstances. But of course, we don't want to see more people in hospital. When we have big numbers like today's, inevitably we will see more hospitalisations and more fatalities. We know that we can only drive those numbers down if we have the overwhelming compliance of Victorians in following the rules. All the research tells us we need at least 90% of people doing the right thing. So I, implore Victorians to continue to follow the rules. I know it's It's tiresome. People are getting weary, but it is important that everyone continues to follow all of the legal restrictions, and that includes those in regional Victoria now. We're very pleased that the numbers have been more modest in many local government areas across the state, particularly some of our most far-flung parts of regional Victoria. But it is important that people take that additional precaution now that we've announced today to wear a mask or a face covering so that they can protect their loved ones as well as their local community and keep that virus out of their communities. Anything more for me? No?
I think we said earlier when we were asking for a breakdown, we don't want to demonise a particular workplace sector. We don't want to be seen to be criticising it. But it's like it's 600 and cases where, a high number, and people have no idea where it is. Can't you trust people with a bit more information about where the transmission is, or maybe not where the transmission is, but just where are the people working?
Industries. Yeah. No. I think. Sorry, maybe I didn't phrase it properly. What I was trying to avoid was getting into some aged care commentary. Perhaps I was a little bit too defensive. I was trying to make the point that there are in these 700 plus today, there are a whole lot of aged care cases. So by way of
It's only 100 out of the 700, isn't it?
well, it's a little bit more than that, I think. The key point here is, to the extent that we're not reticent in any way, if we can get you some more information, we're not wanting to be anything other than completely transparent. If I can get some more information and more granular data about which industries, which sectors, more than happy to do that.
For about a week, and I put in a formal email actually on Sunday night. I just wonder if it's...
Let me follow that up for you, Raf. I'd be distressed if the information flow to you was not as it should be.
In terms of the cases, Professor Sutton said yesterday that he didn't know about any links between the hotel quarantine program and the aged care cases. Has that changed? Are you aware of any links? And I guess for these 700 cases, can we go back, or the ones in the last 100 days, link it to the hotel?
There's no further sequencing being provided to me. I've got no advice on that at all. I think what we said at the outset, though, hasn't changed.
So there's no link.
No, what we said at the outset of this second wave hasn't changed.
Can I ask about the protest planned?
Yes.
Who those people be flying? Will we see incarceration and might we see protest?
Well, I've got a very clear message for anybody who wants to go to that protest or any other protest. Don't do it. The only thing we should be protesting against or fighting against is this virus. Stay at home means stay at home. It's not one of the lawful reasons to leave your home. As for enforcement and how that happens on the ground, that's a matter for Victoria Police, and I don't think you ever want a situation where the Premier is telling Victoria Police who they should fine and who they shouldn't. That would be a very different Victoria. I know this is unique where we're at the moment, but I don't think we want to get to that point. But this is incredibly serious, and every time somebody doesn't do the right thing, every time somebody contributes to the spread of the virus, then that means that another family will be having to plan a funeral. That's just the maths of this. That's just the logic of this. This is a wicked enemy, a silent enemy. It's an enemy you can't see. But the only thing that wins, the only winner from letting our frustration get the better of us or thinking that the rules don't apply to us, the only thing that wins is the virus. The virus wins when we get so fatigued that we stop doing the right thing, or that we get frustrated, or for whatever reason we choose not to follow the rules. It is a formidable enemy, and it will not be defeated unless everyone works together. And going to protests, no, absolutely not. Absolutely not. Protest against the virus. Fight against the virus. Don't do anything to contribute to it spreading.
Just on the issue of fatigue.
Well, I'll resist the temptation of commenting on different platforms of media. I'll also, why give these people any more airtime? Seriously. Like, this is not about human rights. This is about human life. This is not about some obscure nonsense you've read on a website. There are rules. There are laws in place, and everyone should follow them. And I'm not really interested in wasting any of our time or using these examples of appalling behaviour to detract from the vast majority of Victorians who are doing the right thing. They're the ones we should be celebrating. But look, as the case I referred to very briefly a moment ago, the person who went through the checkpoint, police have found her and she'll be appropriately dealt with. So anyone who thinks this is a good thing to do, not only is it wrong, but it's not particularly smart, because Victoria Police are out there and they're doing their job well. They are. They're fair and reasonable, but these are serious issues, very, very serious issues.
Briefly on the issue of fatigue, I think we're all fatigued. I don't doubt you are, because you've been here how many weeks. When you saw the numbers today, what was your reaction to that online?
Well, I get a phone call at about 10 o'clock in the evening that gives me a sense of what's on the board. That's the term that's used, what's there. And then the numbers are not easily confirmed until the following morning. You know, this is a very tough day. But I would just say to people, as challenging as this is, it is within our control, all of us as proud Victorians. If we follow the rules, if we play our part, then we can defeat this. We can drive these numbers down. But they will continue to go up and up if, particularly, people go to work when they're sick. You can't do that. You've got to get tested and then stay at home and wait for your test results. What's more, you know, this is a test for all of us. This is a test for all of us, and I just say that this silent enemy will win if we let our frustration get the better of us. If we can't dig deep and find another reserve, another effort, you know, to absolutely sustain this for as long as we need to, then the virus will win. Many people will die, many more people will die, and opening up will be further away than it has ever been. Sorry?
I asked if there's no disrespect intended, but are you getting any
Do I look like I am? No. Oh, this virus doesn't stop, and none of us can afford to. But it's not about me. It's about doing what has to be done. And part of my job is to accept responsibility for those things that are not done well, to fix them, to get on, to get things done. That's what I do. It's what I've always done. An important feature of the work that I do and the role that I have is to stand here in front of you every day and to answer any and all questions you've got. And if I can't provide you with information, to commit to coming back to you. I am sorry that I haven't got the details in relation to business support, but I'll come back to that tomorrow.